Welcome. My name is Tunisia Owens, and I am the Policy and Advocacy Manager at Family Violence Law Center here in Oakland. And today we'll be having our second conversation in our Summer Safety Series. This summer webinar series, we're trying to explore various tools that survivors can utilize to protect themselves and their loved ones. And we'll be tackling topics such as digital safety, commercial sexual exploitation, legal avenues that survivors can take, and policy changes that might be possible to make our communities safer. And so in this series, we want to disrupt inaccessibility and work towards building a future where safety is not a foreign concept, but is a concrete reality. Obtaining knowledge is one of the most important instruments for protection. And that's what these webinars are about, creating a pathway towards community building, education, empowerment, and a better shared future. Here's our agenda for the webinar today. We'll have introductions, and then we'll begin our panel discussion. We'll have questions from the audience, and then a closing with closing thoughts from our panelists who are here today. The Family Violence Law Center helps diverse communities in Alameda County heal from domestic violence and sexual assault. We advocate for justice and healthy relationships, provide survivor-centered legal and crisis intervention services, offer prevention education for youth and other community members, and we engage in policy work to create systemic change. Today, we have with us Jessica Bartholow, who serves as the Chief of Staff for Senator Nancy Skinner. Before joining the California State Senate, she was a legislative advocate at the Western Center on Law and Poverty for 11 years. Jessica has led some of the most transformational and cross-sectional anti-poverty campaigns in the state and across the nation, and has been recognized by several national and state organizations and members of the state legislature and of Congress for her leadership. Jessica holds a master's degree in political science. Her story of how growing up poor helped drive her toward a lifetime of work against poverty is documented in The Nation magazine and Le Monde. Our other expert speaker today is Cassandra James, who is a senior community development specialist for the city and county of San Francisco. Some highlights of her advocacy include serving as San Francisco Youth Commissioner, San Francisco Transitional Age Youth Initiative Associate, and community liaison to the African American Community Relations Board. Cassandra was instrumental in advocating for the Tri-County, San Francisco, Alameda, and Contra Costa collaboration on trends of system-impacted women, and presently serves as co-lead for Yes in My Backyard, Solano Napa chapter. Vice Chair of the Vallejo Housing and Community Development Commission, Vice President of Black Women Organizing for Political Action, Solano Napa. Cassandra holds a bachelor's degree from Mills College in Politics, Economics, Policy, and Law, and is a candidate for a master's in Public Administration at UC Berkeley. Thank you, Cassandra and Jess, for being here today and talking to us about how we can make our community safer. So what I'd like to do is start with a question for both of you to think about. When we think about safeties and in our communities, that can mean a lot of different things to different people. And so what I'd like is for both of you to talk about what safety means in your line of work. And we'll start with Jess.
Thank you, Tunisia. When I think about safety, I like to think about the United Nations human rights and the Declaration of Human Rights and how it defines safety. It just kind of helps categorize it for me in two different ways. And one is safety from chronic conditions, whether it's hunger or oppression, and kind of think about kind of the big picture of safety. And then the second is safety from something kind of directly impacting you at the moment. And that includes kind of personal safety as well as safety from urgent issues or things that kind of come into the moment, like a sudden loss of job or sudden loss of housing, and things like that. So to me, I think to be truly safe, we have to think about, all of it. And when we're working in areas to increase safety for people, it's helpful to know that sometimes our bodies don't recognize or distinguish between the panic that you feel between the different types of safety. Having experienced both hunger and domestic violence and a survivor of childhood sexual abuse as well, the panic in your body sometimes feels all the same. And so in addressing safety and people who have survived violence, it's important to know that and to think about what are the things we can do to bring in a wholeness of that experience of safety. That's my thoughts.
Thank you for that, Jess. Cassandra, in your line of work, what does safety mean for the people that you advocate for?
So for me, I work in city and county of San Francisco. So I'm working with some of the most economically low income residents that are living in former public housing. So again, I want to just double back with what Jessica was saying around this being a holistic view of creating safety for residents. And sometimes, or not sometimes, and because of certain policies, when violence happens on site, it's hard for us to move a household somewhere else to be safe. And because of this, we have to create or be creative in the way that we work with stakeholders that are on the ground, meaning like nonprofits, different community groups, and sometimes neighbors, in order to get the person to a safe location. And that's just one, being a safe location, but we still have to deal with the trauma that has impacted them. And if a person with children, how are we securing their safety? Because now that extends to different systems. So you're at school, you're having doctors, whatever the case may be, and also explaining and talking to these various systems. Because when we're talking about marginalized or historically excluded communities, there hasn't been that safety, and going these systems and saying, this is what's happening, why I have school, this is, I can't make it to this appointment without that fear of consequence. So in my role specifically, it is letting this power privilege, pulling in various systems and agencies together to explain what is happening on the ground level of someone being impacted by violence.
Thank you for that, Sandra. In the last few years, there's been a lot of talk about reimagining public safety in our communities. And I'd like to talk about some policy ideas that come to mind for you when you're thinking about reimagining the idea of public safety. So we'll start with Jess for this question, and then Cassandra, if you'd like to add to that.
Yeah, I think, what's been most interesting to me over the past decade, I say, as we're really beginning to understand the long-term consequences of being a survivor. It it's been great to have that acknowledgement and to recognize it, and expanding fields, the whole recognition of ACEs, the child adverse experiences, and studying the long-term impacts of that as one example. But what's been fascinating is that our work to study the impact and long-term harm of survivors of violence in various ways kind of ends there. And way too many examples. We study, now we evaluate everybody on Medi-Cal. What is their ACEs scores or their adverse childhood activities? But once we find out that they have a high ACEs score, we do nothing to refer them. In the CalWORKS program, our state's basic needs programs for families with children, which is also part of the Temporary Aid to Needy Family Program, a national program, we began an assessment. The assessment takes 2 hours. The 2 hours are supposed to be where a family coming in to the county disclose, their various needs or experiences, and then from there, the county social services or human services is supposed to provide tailored response to that person's disclosure of their of the circumstances they're facing. When we first started doing these assessments about 8 years ago, we asked for data about what percentage of these families, low-income parents, mostly female head households, coming in, what percentage of them disclosed that they had in their lives a prior sexual assault. We couldn't get the numbers, even though the state was collecting the numbers, and they said that we're using it to change our service model. They said that they didn't have the right to document and share that documentation. And so we had to find the money to pay them so that they could pay for the $4,000 or so to get the report that belonged to the families themselves. If you think about it, right? They came in, they gave 2 hours of their time for this screening, and the information was supposed to come back to them in increased and more reflective and responsive service. And we couldn't even get that information back so it could belong in the conversations about how to serve people. And then when we did, it was so high. It was devastatingly high. Over 60% of families, and you won't be surprised, right, had come in to the door and said they had experienced sexual assault or domestic abuse. And we started asking, well, what do you do? What do you do when somebody says, yes, I've had this experience? Are you more responsive in their welfare to work plan, or, what services? Are you referring them to services to receive additional assistance or victim services, anything? And there was and still is no requirement that they do. There was and still is no resources to ensure that those referrals are adequate, timely, well-serviced. It's just another example, whether it's through the Medi-Cal collection of families' childhood trauma data, or the information as people walk in the door to get rent help, and then they have to spend 2 hours to get this survey done and then never get any help. If you can imagine, this might be the very first time somebody's ever been asked if they've survived a violent circumstance. And at the end of that question, and anybody who's ever been here, anybody who's ever been in a place where they're struggling with what to do in their own lives when they face violence, these folks are alone. They're not given a standard or a documented referral. Maybe a county worker might themselves take it upon themselves to do that, but this is not our systemic way of doing it. So I want to highlight the fact that we are doing a great job of recognizing that the trauma that results from domestic abuse and the rights people have from a domestic abuse or sexual abuse is important to know in service. And yet we're just not quite at the place, I think, as a state, and certainly not as a nation, where we're saying, okay, now that we're documenting this and we know how harmful this is and how urgent it is that we give timely supportive help so that the trauma doesn't spread throughout the community and the family or within the confines of one's bodies and destroy their health, we're just not delivering what we know is probably what service we need to give. So I think that's what I'd like to say about where we're at right now. Yeah.
Cassandra, would you like to
What
weigh
is,
in on that?
yes, I just want to also add that we also expect for folks to go in between these systems and agencies and retelling their story over and over and over again. And we have like the power, especially when you're working for like a city and or a county or even a state, to leverage and reach over to the other department or some community based organizations to say, hey, I have worked with Cassandra. This is the story, and this is what some of the needs we discussed. Please go further with this. And just around, like, we're great at starting, but our follow through and implementation, there is nothing in that part to where we now put the onus on the survivor to now figure out how to follow through within these systems and implement their own safety or their own resources that we started with them. But now it's on them to now figure this thing out. And even if they don't have and we're saying, but we gave you this, so you should be good. And there's nothing at the end. And even the aftercare, we don't even often discuss the aftercare of starting it, making them go through the resources and systems to retell the story over again. But then what happens after the fact? Even and when we're talking about, or Jessica had brought up, how many people actually share what has happened to them. And I know, like myself being a survivor of domestic violence, I still don't share that story because there was no aftercare like for me. And then it's often associated with shame depending on who you are interacting with. And just one more thing, and I know that we are great at acknowledging this is an issue or a problem in society, but it's who has access to that information. Oftentimes, those who are journey level workers or on the ground doing the work, and regardless of the systems, they don't get the same training that managers and upper management get to really provide holistic service to a survivor.
Cassandra, I'd like to follow up a little bit, as you mentioned about who has access to information and resources. I am wondering about the idea of prevention, as that there isn't as much investment in policy changes that are about preventing violence or doing that, like primary, secondary prevention in communities. Can you speak to that a little bit?
Yes. So when we are discussing, whenever we're looking at policy, we have to look at who is at the table, either creating or redesigning policy. And oftentimes it is folks that do not come from the communities or have not been impacted by this type of violence. So when so oftentimes it ends up being reactive to what happened, even though you have the data there. And just going back to what Jess was saying, like, studies have been done, data is there, but how do we now access that data to incorporate it within some preventative measure policy? And that is what's not being done. And that's what I'm saying, like the follow through in that implementation, it takes us back full circle to prevent this from happening next time. Like in my role, we talk about housing and talk about homelessness, but when we talk about homelessness, we never talk about what was that last step before someone becomes homeless. And that may be rental assistance, that may be like trauma informed training and systems in place for property managers or community partners. So it's the same in this. And when we're talking about violence, like, did we offer, we saw the signs or we saw this, do we have, we're now asking questions around ACEs. Are we offering families or individuals counseling or services prior to this? Are we offering them crisis mediation prior to whatever the explosion of whatever may happen, the violence? But we don't do that when we're talking about preventative care. Hopefully I answered your question.
You did. And Jess, I'd like you to also talk a little bit about prevention. I know we talk about the budget as a moral document, but in the state of California, we actually don't regularly fund prevention of violence. And you mentioned ACEs, where when you increase the protective factors that communities have, then that is a form of prevention. So what are some of your thoughts about prevention and policy and where we are with that, especially given your initial comments about ACEs?
Yeah, I mean, I think I just want to highlight something Cassandra said, which is how important it is to have a kind of survivor-centric way of identifying the right interventions and prevention strategies. A perfect example of this is how frequently policies will require, for example, a restraining order in order to provide services to somebody fleeing domestic abuse. And this was in place in the CALR system for a long time. And when we tried to explain that this really shouldn't be there, it was absolutely not, it wasn't a fact that people knew who ran the programs, that the most dangerous time for a survivor is when they file that restraining order. And they, their idea was, we'll tell everybody, if you want a special consideration in the program or expedited services or housing supports, you'll give us the restraining order to show that you're a domestic violence survivor. And they really had no idea until we showed them the evidence that they could be causing somebody's death if they do that. It should really be up to that person with the advice and support of trained professionals about whether or not this is the right decision. So just kind of really reinforcing that every single step we take to decide an intervention or prevention should be survivor-centric, and with the data and resources that are already available to know, what are some guardrails there. With regards to prevention, I think what's exciting here is we are thinking about prevention as a health right. Since the passage of the Affordable Care Act and its enactment, California, more than anybody, is going, wow, Cassandra's more than anybody, any other state, I think we are really diving into what does prevention look like as a healthcare strategy, and how can we fund it with healthcare dollars? Anywhere from talking about diapers to period products. We were just contacted by some folks in the district to talk about gun violence, strategies, and whether or not the ones that intervene right at the moment of a gun tragedy, could be identified as healthcare prevention in a way that could be funded through Medicaid and through our federal Medicaid dollars with a 50-50 dollar. So I agree, Tunisia, we have so far to go to truly understand and identify the right strategies to prevent both domestic abuse and also sexual abuse. we're not quite there, but I feel that we are on a precipice. And this crossover thing that Cassandra was talking about, I think is also really important when we think about all of the different systems that interact for survivors. I've been really inspired by our first partner, Jennifer Seibel Newsom, and her disclosing, how her experience in the courts as a survivor of sexual assault, is something not just she has experienced and that has really been harmful to her personally, but to so many people who are survivors, how we're treated in the courts, it's has to be reformed. That's just one example. And each of these systems have reform that they have to do, and how they work together should be addressed. So I think in addition to identifying prevention as something essential, as a basic service everybody should have the right to, like a right to healthcare and a right to prevention and a right from safety, to be safe from a threat of harm, we should also be thinking about how do we make sure that right and the services we're providing translates and transfers into all the systems that touch people. And those overlapping areas are some of the hardest to get right, because there are different codes in the law. There are actually different codes, different departments, different advocate groups. And for the person experiencing it, it's all the same person. But there's just so much that needs to be there to make sure that they're supported through all of these systems in a kinder and more successful way. Yeah.
Thank you for that. I think this leads into the next question, which is, what are some trends you're seeing in policy spaces in relationship to supporting survivors of violence? And we do talk about various forms of violence. So because oftentimes people are not just experiencing one form of violence. They're not just experiencing domestic violence. They're also experiencing sexual assault, trafficking, gun violence, because these are some of the most vulnerable populations in our community, and they are often marginalized. They're experiencing multiple systems impacting them. But what are some trends that we're seeing for supporting survivors of various forms of violence? Cassandra, can you speak to that first, and then Jess? And I see we also have a question from the audience. So if you can answer that, and then we'll deal with the question from the audience member.
Oh, yes. I think two things that come up, especially on the local level, is the intersectionality and inclusivity of recognizing policy. So like recognizing the survivor's experience that are shaped by their multiple identities. So policies are moving towards being more inclusive. And this is including the unique needs of marginalized groups. So such as like LGBTQ, individuals, immigrants, refugees, like individuals with disabilities, and based off of race. Sometimes prior like policies we will celebrate, because I know it's small increments, right? But we'll celebrate these broader policies, but when you have different groups trying to access or trying to go through the various systems based on the policy, there are additional barriers based on their identity. So that's one thing I do see on the local level, is looking at community-centered or survivor-centered policy based on identity. And then the other one is the interdisciplinary collaboration. So there is a growing emphasis on collaboration between different sectors and agencies to address the complex needs of survivors in a comprehensive way. Again, just going back to, we are addressing some needs, but we're not doing it comprehensively and not specifically to what their actual need is in order for them to be successful. And this could include like cooperation between like law enforcement, healthcare providers, social workers, community organizations to provide a more holistic support system. And like one specifically in the DA's office, they have the like victim support person or restorative justice in San Francisco. And that unit works specifically with the office that I'm in, the Office of Housing and Community Development, and how we can best talk to each other to avoid re-traumatizing the survivor. But these are departmental policies that we now as employees have to advocate to our elected officials to say this should be the standard across this county. Those are some of my initial thoughts, and not to be long-winded.
No worries. We're all here to learn. Jess, did you have some thoughts you'd like to add?
I would just add the part I'm the most excited about, and some people might be surprised by this, but is the part where we really seem to be getting that we're not supposed to blame the person who was harmed. You know, it was only 2018 in which we changed the California law to not read child prostitute anymore. You know, when then Senator Mitchell passed the bill that said we will refer to them as a child who's been sex trafficked. And that's just one example. I think we're in the places where we're starting to, in our laws and our policies and our programming, really understand that this, and it seems so basic, but it's just it's bedrock it's been the bedrock of our public policy to support survivors. Is this bedrock of there's a sense that they somehow are to blame for them being abused. And if you think about it, because that's been the bedrock, not just of how we've created our public policy, our whole systems of care. No wonder, we're struggling. And I think that there's still a lot of hearts and minds to change. Even when we're changing the law, we'll still have a sentiment that there is somehow you to blame, that you were in a circumstance or you remained in a circumstance. And I think we're always going to have to fight that. But I think at least our public policy is now reflecting that. So that's something I'm really excited to see in all different areas of law. And I think we can do a lot with that.
Yeah. We have a question from an attendee who says, when seeking services from the county, and I think this is social services, the SAR 7 is due every 6 months and is often sent with very little time to complete and return the form, resulting in CalFresh or CalWorks benefits being discounted. What policy changes can we make to prevent people needing services from falling through the cracks because of this vicious cycle? And so I think the broader question is, and that's an example of how services can be that are needed, because those CalFresh, CalWorks benefits are means tested, and you have to really be close, like really close to destitute, in order to qualify for those. And so to have your benefits interrupted because of a form, when you're talking about people who are, again, marginalized in desperate circumstances, may have various transportation issues, communication barriers, whatever, like, how do we create policies or change policies so that services aren't interrupted for paperwork, that we can find ways to be creative in how we can accept paperwork or accept responses for necessary paperwork, but paperwork that doesn't have to interrupt benefits?
I would love to just jump in here just because it's an area of law that I've worked a lot on. when I first started out in this space at Western Center, we the application or the forms were due once a month. And then we changed it to quarterly. And then we finally got it to every 6 months. The 6-month policy, it is established in law federally. I always think it's important for people to know kind of where we're stuck. We did fight for an option, and we were able to pass that option a couple of years ago, which allows a late application. If it's submitted a month late, you can still go back and restore the benefits, so you don't have to start all over. You'll lose the time between when it was due and any benefits that would have, like pro rata benefits that would have been for the time that was due to the time you turned it in, but you don't have to start all over with the benefits if you turn it in within the month. That is as far as we can get with current federal law. There is not currently a proposal that that would allow us to extend those times, but perhaps that's something that can be pursued. And I think, but you hit on something that's really important, which is the fact that we allow somebody to fall off into the abyss with no food or help for anything if they don't get that form in, and we don't recognize all the other things that could be going on. There is some good cause if they turn it in late, that consideration, but it's still that we allow somebody to fall off, and that would be all that they would have. And so I think really one of the big and exciting movements here that would really help is if we did implement a guaranteed income or child tax credit for everybody, or this refundable tax credit that would create a guarantee like floor that nobody goes under. And then if you get food stamps, if you get cash aid tied to your participation in welfare to work, then it's above and beyond that basic guaranteed floor that you have, not because you're working or participating in a work requirement or you're doing all the rules right or you're turning the paper right on time, but because you're a human being and you have basic needs, and we have universally acknowledged rights as humans to not be without food and our basic needs met. And so it would be, I think we really have to think about how do we create this guaranteed income beyond a pilot, beyond the child tax credit that we received for a while, so that we don't have to make people suffer because they couldn't get a form in. Yeah.
Would you like to add something, Cassandra?
I just want to add, I completely agree with Jess. I just wanted to add that I think we as a state can do more to advocate, because this is federal law and federal rules and regulations, and like California tends to supplement that within our various social service programs. But collecting the data and understanding that our federal poverty limit does not meet California's poverty limit. And that needs to be a real conversation around what is the economic floor in California for folks. Because and what we're talking about just regionally in the Bay Area, a household of 4, you're considered impoverished if you're making 120,000 or less. So we have to have a real conversation about establishing like a California level poverty limit to where we could supplement these programs, so that way we don't have families falling or individuals falling by the wayside. 1, and then 2, I used to be an eligibility worker in the Medi-Cal CalFresh program. And I know, and from my background in social services, like I tend to do some like mini case management and explaining grace periods. And that's when and earlier I had mentioned who gets access to these trainings, because you have a lot of folks that are on the ground interacting with individuals who are in need, who are saying like, I just have to follow this because these are rules and regulations, instead of I received the training and I understand what is attached to you not eating, what is attached to you having to go out there and getting whatever it is by any means necessary. That to explain there is a grace period. To explain, please just submit this first thing or just take a picture of it and being able to send it in by this date. And that way we can help you fight or appeal this action. So those are like some of the micro things we could do on the ground level. But overall, this poverty level in California and reestablishing that and being able to supplement some of that for our families who are earning more than the poverty limit and who gets minimum from these federal systems because of that.
Thank you both for that. I feel like you all just took me to church. I want to say amen, Pastor. But I would like to talk a little bit about, and I know you both have mentioned this, complex trauma and trauma-informed practices when we're working with the public, but also how do we move beyond only supporting people at the moment of crisis? So as we've been talking about social services, and also when we think about supporting survivors of domestic violence and sexual assault, oftentimes if it's not tied to a criminal legal matter, then you get crisis support, but not support beyond that. So how do we start to look at creating better policies that can support people beyond the moment of crisis so that they are stabilized? So getting folks from crisis to stabilization to thriving. Jess, if you could start, and then Cassandra.
You know, I think it's really important. I know you probably have a very educated group of people watching this, and they probably understand these dynamics, but in case there's anybody who's not or is still learning, I think it's just really important to know that this the dynamics that people experience when they ask for help, you know, is they first kind of are asked for evidence of this, and their evidence is you know, usually first their own explanation of it. And so often the trauma and violence, it happened to you and to you physically, and it's hard to even put things in words. And you know, often it's hard to explain what to anybody, and not even to yourself, because your brain is doing what it's supposed to do, which is to protect you from the trauma. And so I think one of the things that we have to think about is making sure that, as I said before, we're not blaming the person that it happened to. Secondly, we're also not putting it on their shoulders to say the right words, articulate it in the way that everybody expects people to. You know, I'm a very educated person, the first generation from my line of family to go to college, and I have a master's, and I still really struggle to talk about what happened to me, the things that happened to me. It's my brain keeps me from doing it. It's protecting me. So we have to stop asking people to say the right things and act the right way in order to get the help that we have available to them. You know, it's like, do you have the special key? And if you don't, you can't get that help. And that's just not okay. And that includes, you know, requiring people to file paperwork, or charges against somebody, or, you know, I think one of the things we were working on for victim services in the budget last year was trying to remove the obligation that the person file a police report in order to get victim services. this is inhumane to do, especially considering how the public legal system treats survivors. How can we say, hey, you have to do this, and oh, by the way, we know everybody along the way, or not everybody, but very few people are going to be treating you with a trauma-informed and survivor-informed lens. You may be attacked for sharing this information, even by people who are supposed to be helping you. We won't have help for you as you're going through the different iterations of survival and healing. And so we have to stop doing these things. That would be, and it's everywhere in the law. It's in every little crevice of the law, and we have to articulate that this is a desire to stop doing this, demanding. Oops, I'm sorry, my boss. And then we have to commit to changing the law and working through the implementation of those changes with survivors and people who understand what works.
And just to add a few more, we have to talk about like our housing assistance and offering like safe and stable housing options for survivors who are forced to flee their homes. And this can include temporary shelters, transitional housing, but affordable housing programs. Being culturally sensitive support, like recognizing the diverse experiences of survivor and tailoring support services to be sensitive and inclusive. And lastly, I think there needs to be a comprehensive survivor-centered care. We have a lot of centers or facility or organizations that help during the crisis, but the aftercare, the survivor-centered care, to develop a survivor-centered approach to care and recognizing their autonomy and unique needs. And this involves survivors in decision-making processes and respecting their choices.
I would just like to add on to that, and as well, that there is, we kind of all know we have resources to places for somebody to be referred if they're today experiencing the violence. But if they survived it without help at the time, or even if they did, and they're suffering from, the consequences years later, we don't necessarily have a place for somebody to call when they're not in the crisis itself, but are experiencing later harm and suffering related to that trauma and surviving that trauma. And I think we're now recognizing that that's necessary. I think our collective body understands sometimes trauma is able to be acknowledged many years, decades later, but we don't have the services or even, or I don't even think we're having a conversation yet about what is that place? It's different. It's different than somebody calling today because they're in the violence today. So wanting to recognize that as well.
Thank you both for that. I think both of you have moved into talking about housing and safe housing. And so that's our next question. Domestic violence is actually one of the biggest drivers of women and femme-identifying folks homelessness. So what are some solutions that our state can provide, considering that we have the highest homelessness rates in the nation? We're the most populated state, and we have the highest rate of homelessness, which also likely means we have the largest population of homeless women and femme-identifying folks. So how can we start to address some of those things in policy? And we'll start with Jess. Sorry.
Well, I'll just start by saying something that we did a couple of years ago that I was really excited and proud of. It's a first step, which is we have this thing in CalWORKs that's called motel vouchers, for lack of a better word. And the motel vouchers are available they were available to anybody who walked through the door and could prove that they were homeless. They'd have to apply. They'd have to apply first. That could take up to, expedited, maybe 3 to 5 days. And then they would, then they'd have to show evidence of being a survivor of domestic abuse or fleeing domestic abuse. And then they could get the hotel voucher. So as you can imagine, anybody who's been in the circumstance of trying to flee domestic abuse, you need it then. You need it right then. You don't need it 7 days later, 10 days later. So we were able to change the law to say when somebody walks in the door, they walk out with a voucher. All they have to do is self-certify, I am escaping domestic abuse. And I feel like that should be the model for everything. Everything we do in service area, just walk in the door and boom, you should have it that day. Now, there's only 16 days worth of domestic or worth of shelter days, and then you can get it continued to be 32 days. And then we also have another program that you can transition into, which provides you a first and last for rent. We allow for that gap between the 32 days and whenever you identify first and last for a new place, we allow that gap to exist. So you could walk in the door, you're fleeing domestic abuse, great. You got a hotel voucher, great. They continue it to 32 days, wonderful. They're helping you find first and last. They got first and last for your rent, and they're going to help you find a safe place to move to. And they don't quite get it, but done by the 32 days, boom, you're out of the hotel, and you're back into an unsafe place. And so I think that is something we really have to figure out. Like, if we're going to open the door and say, come on in, we're going to help you. We can't have a time limit that doesn't allow for somebody to move to that next step. We'll forever and a day, you hear people saying, well, they should leave if they're in a violent situation. And then, the policies don't reflect that is what what we're supporting them to do when they're ready to do it. So I want to both lift up that positive step that was taken to do that, and then the opportunity that we still have to get it right. I know my boss, Senator Skinner, she had introduced a bill. It was sponsored by Black Women for Wellness to try to close that gap. We didn't get it through, and there's more work to do on that as one example. I think there's a lot of other things in credit checks and, all of the barriers we put for everybody in finding affordable, safe housing. All of those things especially impact survivors and people escaping abusive situations. And we could probably find solutions that help make it better for everybody. Like, hey, don't allow credit checks on things that aren't related to housing impact your rental application. Could we provide more help in that, helping people get into the front door of a rental or to stay? You heard Cassandra talk before. We never look and see what happened just before they became homeless. What was that? And as you said, Tunisia, so often it is people experiencing abuse, and what could be done in that moment, right? There's probably a lot more that we can do overall for affordable housing, but especially for people in this circumstance.
And just to add, that's why I was excited. I believe it's Assembly Member Haney with AB 12 to cap deposits, because people can find housing but have these astronomical number of a deposit to access housing, and our rental assistance program don't cover those amounts. Majority of the times are the ones I'm more familiar with. For example, Season of Sharing, it's a $5,000 cap. So if your deposit is $10,000, how are you supposed to come up with the additional sum? So, in speaking to that, so developing the rental assistance programs that help survivors of DV secure stable housing. So, like the financial support is instrumental in preventing homelessness and helping them like rebuild lives. Also, talking about um, California needs more affordable housing. So, like an affordable housing initiative, like working to increase the availability of affordable housing throughout the state and not affordable housing. And I don't only want um, historically excluded communities to take the burden of having affordable housing just built in their communities. It should be throughout the state. And it's also to provide stability and security and just going back to what Jess said earlier about like the guaranteed income. So that empowerment and economic independence. So that program around like guaranteed income or to promote like economic independence for survivors. That will include like job training, childcare support, like access to various financial services is a step. And we talk about inclusionary housing or specialized housing, but what about specialized housing for survivors? Like we have senior housing, we have like Tay housing specifically like for families, but considering like establishing some specialized like housing options for survivors of domestic violence to ensure that they have access to safe and support environments and increasing funding for domestic violence shelters and support services. Like in Alameda County, you guys, I don't want to say have a slew. I know it's still bare minimum, but you have more services there than a county like Solano County. So if someone is fleeing domestic violence in Solano County, there's one place that you can go to, and then you have to even access there. So that goes, and then we're starting to talk about transportation and justice, and even accessing these places. But I think those are some of the things that we can do or initiatives.
Thank you both for that. As I'm hearing you all provide all these great examples of ways to improve policy, improve implementation, and new ways to look at safety, I'm also wondering, what are some pitfalls that we need to avoid in order to implement effective policy change? So do you have suggestions on pitfalls as folks are thinking about advocating or putting bills forward or changes at the local level, but what are some pitfalls that we should avoid? We'll start with Cassandra.
So some of the pitfalls that, sorry, my supervisor is texting me. Some of the pitfalls that we should avoid when implementing like policy change is often complex and challenging, but to ensure that some of this is successful, it is aware to be just we have these common potholes where it's like the lack of stakeholder engagement and failing to like involve key stakeholders, survivors should be at the table. The subject matter experts who have conducted studies, affected communities need to be at the table when we're talking about policy design or recreating policy that's on the books. And I keep saying recreating because we need to follow the trends that are happening in the community. Although we may put something in place, I will say, and this is 2000. 2000 is not 2023. And there has been changes in needs for our specific, our targeted audience. Also, the insufficient research and data, and just going back to what Jess said, like that's been my favorite thing is just accessing the data and using the data to be able to shape policy. So we ignoring evidence and relying on incomplete information will result in ineffective and counterproductive policies.
And Jess, can you advise us on some pitfalls to avoid?
Yeah, I think I've said them before, which is don't blame the survivor. Don't have policies that blame survivors. Identify, that bedrock level of system that even if you build a new program on top of it, if it still kind of relies on this old, way of thinking, it will be flawed. So that's one. You have to kind of reform all the way through to the bottom. And then the second is don't make the survivor have to take action, take police action, or take criminal justice action in order to receive the support. Don't deny them support because they didn't do it at the time. And then I think something that Cassandra said, I just want to bring back as a pitfall. We cannot do this in a race, ethnicity neutral kind of way. We have to understand that whatever we put out as a policy solution, if it doesn't work for traditionally disenfranchised people and people who are discriminated against on a regular basis, if it doesn't work for them, it won't work. And that has to be essential. We have to build these programs with not just survivors, but diverse survivors and their advocates in the room, and people of color, Black women. We need trans people. We need people who identify in across the spectrum to be part of finding and implementing these solutions. And if we don't, we're going to have systems that don't work for all the people who need them.
Well, I think both of you answered this next question, but if you have anything else you want to add about how community members who are often forgotten or dismissed, how can they get involved in creating or making policy change? And we're thinking about marginalized communities in this question. So youth of color, unhoused populations, people with disabilities, etc. How can they lift their voice and be part of policy change?
Just to jump in, I think we have to move on the dais and go into communities and have a real conversation with communities. So it's a partnership with stakeholders, any community-based organizations, schools, and elected officials on all levels. And I remember when I first got involved, like I was like, well, F the police, right? And I'm this 17-year-old kid. I was like, but that was the violence that I witnessed in my community. And somebody had to pull me to the side and say, instead of saying that, have you thought about talking about culturally competent community policing in your community? I'm like, what do you mean by that? So it's this translation between your lived experience and going and talking to a policymaker or those who with the pen in hand. But we have to also get beyond, just going back to what I was saying, just get beyond the dais. It's more than just sitting at the table and going up for public comment. It's getting that person to beyond the dais and coming into the schools and coming into the community to have authentic, real conversations about bread and butter issues.
Yeah, I mean, I think there are lots of organizations out there doing this work, and really, I'm so impressed by them and how they are going about it. And I'll just name some of them: Young Women's Freedom Center, Youth Alive, Californians for Safety and Justice, and it's amazing to see, the ways in which they bring forward the conversation, and sometimes surprising. Sometimes it should be surprising if we're having new voices that haven't been heard before, new conversations in the community that haven't been elevated, haven't been given the support to come forward. It should be surprising, and they have been. It really is challenging the ways in which we think about safety and healing and prevention. and it's not, these are new conversations. So I would say, I think the most important thing is to support those organizations, support those conversations, make sure that they have a place to be in Sacramento, not just as Cassandra was suggesting, the day of the hearing, but when a year before, when people are talking about what the bill is going to be and what the proposal is going to look like, have those proposals come from the organizations that are doing that work and support them. We just, in the senator in the budget this year, Senator Skinner gave $1 million on the topic of reducing sexual assault behind bars. And this is $750,000 will go to Young Women's Freedom Center to support ambassadors both inside and outside. And the other $250,000 will go towards CDCR. They're going to have to put together a report with the ambassador program and work together. It's going to be really hard. I hope it works. I'm going to believe that it will. And I just know that little bit of help is going to bring forward whole new conversations about prevention and about healing that we haven't even heard of or thought of before. So I guess for people like me that are now, maybe at once were organizers, but are now in a position of power, be prepared to hear things you didn't expect to hear. Be prepared to learn new things, because there are new conversations happening and new voices being brought forward. Make space for them. Ask about them. When people come and talk to me about homelessness, I say, great. And who here has been homeless? I want to know. And each time, more people who are homeless come up on the Zoom or come into the meeting, because I think they're understanding that we need those people in the room to really have the right conversation. And we should do that across all of these spaces.
And we are coming up on time pretty soon here. So I wanted to give both of you an opportunity to give closing thoughts. And so our closing thought question is, in an ideal world, what is one policy idea that you wish we could implement immediately in California? And so we'll start with Jess, and then Cassandra will close us out. So Jess, what policy change would you like to see immediately implemented in California?
And by immediately, I mean, it should have already happened a long time ago. I just wish that any time we asked people if they had survived violence, we responded to that question with resources to help. It seems so simple. But I would like that in our public benefit law, in our public safety law. I'd like to go back and fix the places that we've changed the law to not say a person is a child prostitute, but that they are a child sex traffic survivor. But how many decades of girls and women came in to the criminal justice system? That was their first door into the criminal justice system. We did not treat them as a survivor. We did not provide them help. We brought them further into the criminal justice system, and there they are now, and they're stuck there. And could we go back? I'd like to also, in addition to making sure every time we learn of somebody's survivor status, we help. But I'd like to also go back as we're changing laws to be better. Can we go back and identify those individuals who were harmed by our response to their trauma as if they were criminals, or if they did something wrong? Go back to all of them, wherever they are now, whatever their age, and say, how can we help? How can we reverse this? We can't ever go back and make things right retroactively, but how can we be making things better moving forward? Can we reconsider if they're still in the criminal justice system, can we give them a chance to go back and go to the court and get a new consideration of the impact of that trauma? Can we if they paid fees into the criminal justice system because they were pulled in as a child sex trafficked survivor, but not treated that way, can we give them back that money? So those are actually two things I cheated. I want people to be serviced every time that they declare that they're a survivor. And I want to go back and fix the things that we now know we did wrong for survivors of domestic violence. The same thing happens there, right? People are brought in because they called for help and then they were arrested. I want to go back, identify those folks and help because we did it before.
And again, like I'm just like wanting to like hug Jess because like it very much the same. And one thing, and just to add one thing, because I believe we should be working ourselves out of a job. This shouldn't even be an issue, right? And like, and if I'm thinking of just like one see that women, it's not even just one policy because there are so many. Like, how do we continuously to operationalize equity and infuse that within policy so that way all communities get the resources, holistic resources, so that they can decide how they will thrive. And I think that's something, and I know that you said one policy, and I think I cheated too, because it's like there's 100 policies, but we really should be working ourselves out of a job in doing this work, but making sure that we continue to infuse and operationalize equity and sometimes reparations into policies so that way, again, people can access the resources that they need to define what it is that they need to thrive. Thank you.
I want to thank you both for all of the wise words and advice that you've given us, the ways to fix policy, and just helping us rethink safety and how we treat victims and survivors of violence at every stage. I just want to share my screen because we will be continuing these conversations in our summer safety series. August 1st, we'll have National Night Out, which will be hosting an event at the Family Justice Center in Oakland. And our next Thursday lunchtime discussion will be August 10th. And then after that, August 17th. So we'll be here on Zoom on Thursday afternoons at lunchtime to have these deeper conversations about safety, about how our communities can be made safer, the ways that the law and policy intersect, and how communities can get involved in creating safety themselves. So please join us for some of those discussions. If you joined us late, these discussions will be posted to our YouTube channel, so look out for that. And join us for National Night Out on August 1st, where we'll be enjoying some fun games and activities, and you can get information. Thank you for joining the Family Violence Law Center this Thursday for our summer safety series, and enjoy the rest of your day. Thank you to both of our speakers.
Thank you.
Thank you. Bye-bye.
Bye.
Bye.